Good afternoon or good evening if you're joining us from Africa. Welcome to Open Classroom. I'm Janet Gillow, the Director of Professional Development for the Brown School here at Washington University in St. Louis. We're delighted to have you with us for today's program. I want to acknowledge my colleague, Laura Peer, who's the Associate Director for the International Center of Child Health and Development. She's going to be moderating your questions through the chat during today's program. Before we get started, just want to remind everybody that on the Zoom webinar, we can't see or hear you. We can't call on raised hands, but chat is enabled and your questions and comments are welcome throughout this webinar. We are streaming live to YouTube and we want to welcome anyone who's joining us there or viewing the recording later. We're not able to moderate Q&A through YouTube. So just to let you know, a couple of things that are coming up on Open Classroom, we have multiple free programs every week. And absolutely anybody, anywhere in the world is welcome to join us. So we will be back on tomorrow, that's November the 11th, for a program called The Beautiful Brutal Binary, Why the Problems of Artificial Intelligence Can't Be Solved by Artificial Intelligence. That's part of our AI and the Social Sciences series, a talk by Linnea Brumbaugh of the McKelvey School of Engineering here at WashU. And then on Monday, November the 15th, we have a program on the development of social work in post-Soviet countries offered in partnership with our colleagues at the Center for Social Development. I'd love to have you come back for that or any of the other dozens of things coming up. But now it's my great pleasure to turn the program over to Dr. Fred Sewamala. He's the founding director of ICHAD, the William E. Gordon Distinguished Professor, and the Brown School's Associate Dean for Transdisciplinary Faculty Research. Dr. Fred, please take us away.
Good afternoon, good evening, good night, wherever you are. My name is Fred Sewamala. I'm a professor here at Brown School. I want to introduce myself again with all the details, because I really want to be able to introduce my colleagues, Professor Yen and then Professor Janet. I'll just go with those names because I may not be able to pronounce Professor Yen's last name, although I can for sure pronounce Professor Janet Nakiguddeof's last name. So as the director of ICHAD, I'm delighted definitely to welcome you to what will be our final ICHAD and Smart Africa speaker series for the fall semester. So we want to thank each one of you who has attended the past speaker series, and we invite you again to attend next semester. Really, as you know a bit about ICHAD and Smart Africa, the series really what it tries to do is to elevate our current global research, not only what we do, but what our other colleagues work on, especially that for research that is focused on the well-being of children, adolescents, and their families. And today, definitely, we have the pleasure to introduce two people who are working at the center of these particular issues. So the first one is Dr. Yen, or you can say Dr. Keng-Yen Huang. I hope I said it well. Dr. Keng-Yen Huang is an associate professor of population health and child adolescent psychiatry at New York School of Medicine. She's a global mental health expert. She works on health disparities. She works on prevention and implementation in research. And her research has been heavily funded by NIH and other institutions, both federal and foundation. And much of the work also investigates mechanisms of mental health disparities. They test costing, and they look at system level approaches of prevention. And then also they try to work around integrating scalable strategies for broader evidence production. Her current research really includes two main areas, the way she puts it herself, that she wants to develop and test both M-Health, or some people call it E-Health, strategies for mental health promotion with children, adolescents, and their caregivers. Then the other part that she's really passionate about is studying effective strategies and mechanisms for scaling up, sustaining multi-level approaches of evidence-based intervention. Oh, wow, mouthful, both in the US, Africa, and European countries. So that's Dr. Yen. Now, Dr. Yen is going to be presenting with, together with Dr. Nakiguddeof who is a colleague, a friend, and a countryman. Many of you know I'm originally from Uganda. Dr. Nakiguddeof is a behavioral science lecturer and clinical psychologist in the Department of Psychiatry in the College of Health Sciences at Makerere University in Uganda. That's where I also had my first degree. As part of our work, she mentors undergraduate and postgraduate students, both in behavioral sciences and bioethics. She's also involved in clinical work in hospitals and also does work around psychological assessment and management of patients in several national referral hospitals in Uganda. She specifies two, but she does probably work in more than those two, which is Mulago and Butabika. So in 2015, Dr. Nakiguddeof was awarded the Johns Hopkins Forgotten African Bioethics Training Program, a scholarship for her to do that enabled her to serve in the capacity as a focal person for Ugandans on the African continent in the Africa Ethics Working Group. So both our speakers, Dr. Nakiguddeof and Dr. Yen, mentors in our training program, which was one of the training programs, which is a T33 lead training program. And so we are extremely excited to have both of them spend an afternoon here in the US with us, and Dr. Nakiguddeof spending your evening with us. So you're both welcome.
Thank you so much. It's such a pleasure to be here with my colleague together to present, give you a perspective about past 10 years, what we've been doing. But like Dr. Fred mentioned, we are not just doing the school mental health program, we're also testing and developing the mHealth approach. But for today's talk, we're just going to focus in on the school mental health implementation research. I'm going to share the screen. So the talk of this title is Advancing Scalability and Impact of Teacher Training Program for Promoting Child Mental Health in Ugandan Primary School. So the way that we're organizing this talk is I'm going to give you a brief history about this program, how we started and how it's evolved over time. And the second part, Dr. Janet is going to present the current scaling up study and so give you a sense about what are different activities happening in Ugandan school system. So I want to acknowledge a lot of funding agency, and some of today's talk, I'm also going to share with you the lesson that we learned from Uganda and how we also apply to other countries. Just give you a perspective, what's that process look like if you're interested in disseminating, implementing intervention in diverse settings. Like you all know, child analysis and mental health service and research are limited in low-middle income countries. And generally, we're talking about 3 area research gaps. So one is the epidemiology research gap. So we know we don't have a lot of data to understand the mechanism. So that's something we need to think about when we're designing implementation studies. We also know the knowledge communication gap is a huge issue. And so like promoting mental health literacy and communicate those information to community is critical. The intervention gap is also like quite large, especially like in school mental health system. There's most of the low middle income countries don't have school mental health system. And so those are the issues we're addressing. And so we are thinking about the approach based on the WHO Comprehensive Mental Health Action Plan, but also thinking about how to build capacity to develop structure to support preventive care. And so a lot of our work more on prevention. And so the best setting for doing that is in community. So relative to the healthcare system, it's a lower cost approach. And so when the country or the settings do not have the system, how do we develop that? It's become a challenge, right? And so WHO approach is thinking about cross-disciplinary partnership, including policy stakeholder, academic stakeholder, but also community stakeholder. So that's kind of the approach that we're taking. But also task shifting, task sharing, it's a very critical approach. So how do we testing that in our prevention work is something that we'll also pay a lot of attention on. So, so ParentCorps, it's an evidence-based intervention that is developed and tested in the U.S. context. It is primary focusing on high-risk family live in poverty situation and also like with diverse challenges. And so targeted on social adversity is one of the key goal and helping family and school providing safe, nurturing environment and predictable environment for healthy growth. So that's the key purpose of the intervention. And so the program in some way it's relevant to low middle income country because the target population has a lot of similar characteristics. And it's multi-level. It's also because we're focusing on school community. We're also focusing on school staff and as well as the family. So the original design of the program is focusing on all three levels. And when we move to low middle income country, how do we think about keeping a lot of key components that need to be doing some adaptation because of the resource challenges. One issue I also want to highlight is that the program primary focus on social emotion, learning and foundation skill that kids need to have. So emphasizing the early childhood, younger children. And so by addressing some of those social emotion learning needs, also addressing the health and academic achievement issue. And so this is what is the intervention looks like. We have the professional training that's targeted on teacher and also have the parenting program, which target parents and providing effective parenting strategy. And once teacher and parent learn about those evidence-based strategies, they could apply those in the school context or apply it in the home setting, right? And so a lot of reinforcement practice is also happening in school through the teacher, because once the teacher receive the training, they could also apply those strategies in the classroom. And so they are in US model, there's the menu that can be used in the classroom setting. And so you can see this is representative to task shifting in a way, because we are training teacher on those skills. When the resource is limited, one way to leverage that is having teachers to provide information to parents. So it's indirect ways like teachers offering, sharing the strategy and help parents using those strategies. So that's where we're the task shifting that we're thinking about. And you can see the outcome that we're looking at, not just social emotion regulation, but also achievement, mental health, and physical health. So the evidence from the US, we found impact on positive parenting, impact on classroom environment change, and also have impact on school readiness and academic achievement. And this also has been tested with longitudinal long-term impact. And so we are hoping that we can see this similar finding in Ugandan study. So we start out by doing a pilot implementation study to see if the effect can be replicated. So just give you a sense, we start with working in Ugandan for 2 years. We also try out that parenting program, which we're not going to present that today, but we based on the lesson learned, we integrated in different ways, which I will describe a little bit more. So following the Ugandan study, because the success, the impact, we also partner with agency in Nepal to try out the same intervention, but slightly different implementation approach because the geographic setting is very different. So that's also something we learn about localizing implementation approach how do we adapt that, and how do we changing the model based on the local resource and the structure. But today I'm going to focus in on just Ugandan. And so this is kind of the history. We started in Uganda, and we went to Nepal, learning some approaches, new approach to implement it in rural context, and now we're bringing those back to Uganda and implement the school-based program in urban and rural context. So dissemination implementation framework is always the key framework guiding our work. And so just wanted to give you a little bit context about Ugandan. The population is growing, especially for young population. Like just over past 10 years, the period that I'm working there, you can see the population is already growing like over 10 million. So imagine all those new population are children. So in Uganda, like more than half of population is under 18. And so there's a huge need there. But you can also see most of the family also has affiliation with religion, and majority are Catholic, and you can see in Nepal, it's a very different context. Violence is also very common, although we don't directly talk about violence, but we're also very interested to see how the program changing the violence environment in the classroom, but also in the home setting. Okay, so emotion issue, also give you a context from our previous work, it's about 15 to 40% of children have some sort of behavior issue. And we know in this population, parents' depression is also a huge challenge. And so we're going to talk more about that later. So just give you a little bit context. You can see this is a very different environment. Okay, so how do we start it? So this is an implementation question. Like when you have an evidence-based intervention, bring it to other locations, different population. We are interested in whether it's transportable, right? It's an implementation model, relevant, can that be transferred? We're also interested in impact on teacher as well as the impact on parents. And so in earlier study, we are also interested in what are the contextual factors might impact the quality implementation. So we're also focused on observation in this area in our earlier work. And so using those lessons learned, we kind of modifying the adding additional strategies to address some of those contextual issues. And we're going to show you some examples. So this is the implementation framework translation framework that we apply. Just looking at how an evidence-based intervention start from pre-adaptation, figure out what are the issues that we need to focus on. So during this phases, we carry out need assessment study, understand what structure can we target and leverage those structure and the strengths of the local school community. So then we base on those information to modify the content of the intervention. But I think a lot of modification is on the structure, the setting up the structure. Like I think most of the content, it was able to maintain in the way, but the example needs to be changed. And based on that, we then, after the adaptation, we then carry out a pilot study, understand the impact. So this is also the implementation evaluation framework that we look at. So we focus on the training quality because the training is provided by the local. We start out with having mental health professionals to provide the program, but the current scaling up program is a different model, and Dr. Jenny is going to describe a little bit more on that. So the model is that we provide 4-day training. We try it out number of days so we can figure out what is the day that is required. And then following the training, we also providing group support. Means that once teacher receive the training, when they go back to the classroom, we need to support them so they could apply those skills in the classroom setting. And this is also because interventionists cover many strategies. The evidence-based strategies, some of those are through their challenges using the difficult example, we can help them to address and apply the skill in the classroom setting. So as you can see, we are interested in how teachers change in their practice and also their knowledge. We are also observing the classroom environment. So in our earlier study, we also have classroom observation. And later when we move to Nepal, we're also using the student report. And I will show you some of those results. The part is the multi-level part, the parenting intervention I mentioned earlier. We are interested in earlier phases. We see how teachers apply the skill. Once they're learning, we observe how they use. And when we know that they actually share with a lot of parents and a lot of other teachers now receive training, we know those are the opportunities. So we leverage that. So we developing some of the content material so we can share with the teacher, and then they could using those hangouts to share with parents. Or using the opportunity, the parent-teacher conference meeting. If the school has a structure 1 or 2 or 3 times per year, those are the opportunities that teacher can share with parents about the strategy. Interestingly, we also found a lot of teachers actually reach out to challenging students and doing home visit and providing some of the skills that we teach them. How do you help parents figure out what's the problem and develop some plan? And so they actually do that. And so that is also like the home visit part. It's very unique to the Ugandan culture, which we don't see it in the US context. So you can see this is based on the hybrid type 1 implementation model, and we're observing some of the context. I'm not going to go over the detail of the intervention, the evaluation design, but this is based on the trial study from the 10th school. Just want to quickly highlight some of the findings that we found in both Uganda and Nepal. So this is the characteristic I mentioned. The parent and teachers, the teacher's knowledge on evidence-based strategy actually is pretty low, and this is relatively lower than what we see in the US context. So this is not very surprising. The caregiving practices using spanking, using harsh discipline is also very high. So how do we evaluate saying this program can work in Uganda? Right? And so we look at what's the adherence and also teachers' practice based on some of the feedback and also our observation. So we conclude that given that the implementation, the content they're able to deliver is it's very high, and also based on the teachers' acceptance of the program. Okay, so highlight a few things about the impact on teachers. Like I mentioned earlier, that we observed that a lot of teachers, like over 70% of teachers actually sharing with other teachers, and majority also share with the family. So in Nepal, when we restructure it, when we intentionally bring it the material for teacher to share with parents, and actually the sharing experience increase. And so it also helps us understand when we set up the environment in the right way, it also help community health workers doing more and have better impact. The school context, when we are in Nepal, we also look at some of the school attendance. It actually also has impact because a lot of children in low middle income countries need to travel to, a lot of travel time to the school because of the distance. And so attendance rate, sometimes it could be an issue. And we were glad to see impact of the intervention because it's changing the classroom environment. It also helps students, like students would think it's fun to go to school, and it actually changing their attendance. So violence is also one thing based on the student report. We also found their perception about teacher behavior change, which is very encouraging. So come back to the context. What do we need to pay attention? I think some of the key about the communication within school, teacher that also impact on how much they take on uptake the intervention strategy. So that's something we're paying attention. So now I'm going to shift to, let's give you a context, shift to Dr. Janet. She's going to share with you our current trial in Uganda. Dr. Janet.
Thank you very much, Professor Yen. Thank you, Professor Swamala, Laura, and Janet, and everyone else for organizing this. So currently, we have two studies that basically looking at the professional development program. It's ParentCorps, but we're also calling it the professional development program. And we are also calling it, a socio-emotional learning program. So we have two studies. We have an RO1 that is being funded by NIH, and then we have a USAID project, and they're both looking at basically the same professional development program. However, the RO1 is on top of looking at the professional development program for teachers. It's also looking at a stress management component that is actually new that we need to test out. So this is the very first time we are incorporating this into the professional development program. And then the USAID project, which is also looking at the professional development program, is adjunctively looking at socio-emotional learning as a way of dealing with stress. And yes, especially, that we are into this COVID pandemic. Next, please, next slide. And so looking at where we are coming from, we've done the preparation, we've worked on the implementation, and results have actually showed that, this is feasible, we can do it, and we have very good, strong evidence that the program works. So what we are trying to do right now is to scale up and look at the cost effectiveness of this program and how it can be sustained. So centrally, we have the Ministry of Education, and we have two sites for the RO1. We have an urban site, and we also have, which is in Kampala, Chibuli, and then we have a rural site, which is Hoima, and we're working with teacher training colleges to work on our overall goal, which is to task shift. Previously, the mental health professionals were trained in the program, and so they were the ones that were delivering the program in all our previous work. So what we've done this time, what is different, is that we are training the tutors of primary teacher colleges in the two sites, actually 3 sites. The third site for the USAID is Nakaseke. And so we are training them in this program, in the professional development program. And we are looking at a way of how this model can be scaled up so that the tutors, Ministry of Education, can actually eventually own the program and be able to run it. So we're examining the effectiveness and effectiveness of this program on teachers and students. And we're also examining the underlying intervention implementation mechanisms. So like we've told you, we are also looking at a stress management package that we have started adapting and testing in the RO1, and then a social-emotional learning component, which is not very common in Uganda, because I think it would be the very first one of its own kind. Looking, for the longest time, I was trying to get the equivalent of a local term for social-emotional learning, and I was failing. And then finally, out of the blue, it occurred to me that it was Ubuntu, like in South Africa, and reading about it, that is actually what we are doing. So Ubuntu has not been taught in primary schools. It has not been taught in our institutions. So this would be the very, very first time that we would be doing this. But surprisingly, it also has, it also works on stress management, because, in Ubuntu, social-emotional learning, you're mindful of what others, are going through, but you're also mindful of, you are also aware socially and emotionally of where you are at and how you're feeling. So we're doing this. Have we worked with Dr. Dixon Chibanda in the friendship? No, we have not. We have not, but I think that's interesting, and it should be, I'll take note of that name and look him up, because never know, there might be other collaborations coming along the way. So, so what are the effective, our aims are, what are the effective, okay, thank you very much, Yen. What are the effective strategies to scale up and integrate the professional development, social-emotional learning curriculum into Ugandan primary school education system? Number 2, to implement evidence-based using a new scalable implementation model, and also evaluate the effectiveness of the T-wellness. The T-wellness is the stress management component that is actually new. And then we also want to examine the effectiveness, implementation mechanisms, and theory of change underlying that implementation. Okay, next, please. Okay, so in the sustainable scaling up of using the implementation model, we have had to collaborate with the Ministry of Education, and with the Ministry of Education and Sports, we are specifically working with the Teacher Education Training and Development Department. This is the department that is responsible for the training of teachers, and in there we have the commissioner, we have other people who are involved, and then we've also, in line with them, we've gone to the primary teacher colleges in the country, but we're mainly looking at these 3, and we hope we can, we can further scale up. but there is also all evidence that, they want this. So in the task shifting strategy, instead of having the mental health workers doing the job of training the teachers in the primary schools, we've decided to train the tutors so that the tutors can in turn train the primary school teachers, and then the primary school teachers are going to implement the program, and we're going to assess and observe and be able to come up with results showing that the tutors can actually do a good job, hopefully. So system level intervention strategy, we are applying the WHO's scaling up. And yes, so we have the PTCs, we have the Ministry of Health, the mental health facilities, and we have trainers. So the partnership, we are working with Ministry of Education, we are working with the primary school teachers, we are working with the tutors at the colleges, we are working with Ministry of Health, the commissioner and her group. We are also working with Makerere University, the mental health professionals. We are working in the community, at the level of the community. We have, we are working with the Parent Teachers Association members, the board members, and the workforce that we actually have at this level that we have trained. We've trained the teachers, we've trained the community health workers in the wellness strategies. We have the PTAs who have also been involved, and we're hoping that this can actually strengthen the family engagement and outreach components of the program. Next, please. And so with all this, we have in checkpoints. For example, we were trained, the Ugandan mental health professionals, including I, were trained by the US team, the New York University, and then we implemented. And so we're being supervised by the New York team, and in turn, we are supervising the tutors that we have trained, and in turn, the tutors are supervising to ensure that this is primary school teachers, the tutor, any challenges along the way, they are addressed, and we are consolidating and supporting ourselves and each other. Next. And we're using the parentage model. So testing the additional implementation strategy, this is the T-wellness. Remember, we are into the COVID pandemic, and teachers have lost out on their earnings, especially the private school teachers, but also the government school teachers are not earning as the way we are stressed, and we all distress. If we can manage, sorry. Okay, I'll mute my video. Sorry. Okay, so why did we come up with this additional implementation strategy? We came up with the implementation strategy coincidentally, of course, because the COVID came in, and it actually became very handy. But our assumption was that if teachers are less distressed, if they are able to deal with their emotional and mental health issues, then the teachers should actually do a better job with the professional development program. If this happens, then we should be able to see a very, we should be able to see improvement in the mental well-being of the children that the teachers are teaching, and therefore that's the reason why we had this additional implementation strategy, and it includes an M health screening of mental well-being and a workshop of 5 to 6 hours, and then we have 3 group support sessions that help to consolidate what the teachers have gone through, have learned in the T-Wellness. Next slide, please. So we did a pilot of this T-Wellness, and in the post-intervention report, this is what we included. We did a stress analysis. Teachers were taught, were showed how to go through managing physical and emotional signs. We had managing problems using problem-solving techniques, and then strategies to improve mental capacity, for example, reframing and helpful negative thoughts. We had social support strategies, and we have results that showed, next slide please, that actually the effect size for the T-Wellness intervention was ranged from moderate to large, and teachers reported having been helped by this T-Wellness intervention. That was an addition. And so we hope that this is going to further enhance the program development that the teachers are being trained on, and also it will help the teachers to manage their stress. Next, please. So one thing that we've not talked about is the social emotional learning. We are yet to evaluate that, but hopefully by the end of this year, we should have some data that we're going to analyze and be able to come up with hopefully results that will show that Ubuntu actually is very, very helpful in alleviating distress. So this is our timeline. We've recruited 3 teacher training colleges: Bulela in Hoima, Chibuli in Kampala, and Nakaseke in Luwero district, Nakaseke district. And then we have built capacity for the professional development implementers. We have trained tutors. We are training teachers, but we've also trained mental health professionals. We are trying to work on agenda inclusiveness, adaptation. We are not yet there, but we should be there by probably mid this coming year. And yes, so far we've recruited 36 schools with 540 teachers, with 1,980 parent-child pairs. So we're supposed to be doing a follow-up this coming year. No, a year of follow-up will come at the end. Okay, so next, please.
I will jump in to explain this.
Okay.
So, like Dr. Janet mentioned, the program has like 3 arms. We have one arm with teacher wellness. So the goal is using it as an implementation strategy, but also looking at it as a sustainability strategy. Because we think by improving teacher wellness, they would also more likely to sustain over time. And so that's something that we will evaluate for 2 times post-intervention. And so the mechanism, we're using this trial data to also understand implementation effectiveness mechanism. And so the intervention mechanism would be looking at whether both interventions would result different impact on teacher practice, and then that would further impact on students. The implementation mechanism would be also understanding additional implementation factor to see, like, for example, quality of implementation that would also impact on this changing process. So that's the mechanism that we're trying to understand. So up to you, Janet.
Thank you so much, Ian. So our scaling up efforts in Uganda, we just want you to remember that this is in the context of COVID, the COVID pandemic. However, we've still been able to achieve. We've created a partnership with policymakers, especially Minister of Education and Minister of Health. And Minister of Education is very excited about this because as the children and teachers are transitioning into getting back into classrooms this coming year in January, they're looking for means that are going to be supportive of this endeavor, that are going to help children get into a classroom without fear. Remember, children have not been in the classroom for the past 2 years. So this should really, they feel like this is going to be helpful. And one of the things that we have to do, like before this month ends, is that we're going to have a dissemination workshop with stakeholders, with NGOs, with academic partners, academic community, and other stakeholders. And then we are also they've invited us to train all the primary school tutors in the country using Zoom. And we're supposed to give them a 1-day orientation of the professional development program with the hope that they can actually take it on, they can own it. So we are in that, we're going to be looking at the different scale-up strategies to integrate ParentCorps in teacher training systems or ECD system. They are also wondering as to how we can have this as a course unit that will be examinable at the primary teacher colleges for pre-service trained teachers. But we're still looking at the logistics, and we hope this can work. And then the OT wellness is something that is really they are looking at, because there's been indication that it actually works. And yeah, we are looking at integrating equity perspective and strategies, and be mindful of the gender and racial inequality issues, mostly the gender. Racial inequality might not be an issue in Uganda because essentially we are all the same one race, but I think gender and its cultural underpinnings might actually be an issue, especially now. Next, please. Yes, and thank you for giving us the time. Thank you very much.
So we'll take some question. And one thing I also want to highlight, Okay, one thing I also want to highlight is that I think in the past 2 years, our project timeline has been delayed, but because we'll also implement the same program, it has been modified, also been adapted and in the US context. And so there are a lot of co-learning experience because in US we're implemented in New York City, we're working with Department of Education. And so that we are doing the tier approach, means depends on the risk status in different schools, it depends on the zone. We're implementing different level of intervention. So the co-learning part is very interesting because I think we wasn't expect this is like a COVID impact, COVID intervention study. And so in some way, a lot of similar experience that I think in US context, a racial issue comes up and that also, it's a new challenges that we have to think about how to integrate that in the intervention. And so similarly, I think in low middle income country, we know gender-based violence, it's a big issue. And so we are thinking about how we can do a better job especially in early childhood, try to make some of those changes. And I think there are parallel approaches, but so that's also where I think the benefit, the advantage, the program that we have allow us to do that. I'm going to stop and see if people have questions.
Yen, there is a question about the study retention, participants retention being high, and why, and what can this be attributed to?
So I am not quite sure this question is related to the earlier study or the current one. So just give you a sense, the current study, we are recruiting half of the sample this year, and next year we're going to do the same for another group of schools. The intention is that we think that teacher training center tutor to implement the program usually take time. Based on our experience in New York, we know it probably would take 2 years. So this year, we're more like practice run for them to see if the whole process, how the whole process will work for them. And so next year, we will modify and continue building their skill. The retention part, that's also something we don't know yet. I think the retention relates to teacher training, college tutor. It's one area that we need to pay attention because some of those tutors, once we train them, they could be moving somewhere else. And so I think having the college buy-in and training more people, that could potentially addressing those issues. And in terms of teacher retention, that's also depends on the turnover rate. And I know in Uganda, it's also an issue, but if we can make this as part of the professional training in education system, then those kind of issues can be addressed. So I think through this collaboration, I think it also kind of facilitate, like ministry is thinking about the professional learning training program. Can we integrate that as part of the professional learning for Ugandan teachers? And so they are developing policy. It's not there yet. So we're very excited about the opportunity. And that's also the parallel piece that we see in New York context, because the way that we integrate to make it more sustainable is to look at the professional learning structure. What does it look like in the education system? And we're trying to integrate our training into those structural systems. I hope I answered that question. And thank you for sharing the French bench, which is a program, family program that I'm very familiar. I think it can be using in different ways. And I do think those strategies it's a good add-on. So once we organizing parents together, how do we facilitate some of those conversations. I think combination, integrate with other strategy, it's going to be very helpful. And those are, I think, we can think about integrated in school, and very similarly, we also explore some opportunity in faith-based organization. And so I think depends on the context, depends on the opportunity. I think some of those gathering opportunities seems to make more sense in church setting than in the school context. And so those are some new thinking that I think is very exciting to integrate different intervention. Thank you for that question.
Okay, I just wanted to point out that for early researchers wanting to do related research in this area, I think for all research that one is doing is, I don't know about other countries, but I know for Uganda, you always want to be, you want to create a network for, you know, for people who are going to be, for the consumers and for people that you're going to be collaborating with. For example, if we had not networked with Ministry of Education, I am not so sure we would have gotten this far. But it's also very important that, you know, when you have your results, you can actually disseminate your results so that they get to know what exactly you're doing. And then they'll also tell you the gaps. Like, for example, how we started in 2000, I think it was around 2011. And the very first feasibility study that we did, we disseminated, we went to the Ministry of Education. They had a meeting, it was a Monday, and they always have meetings on Mondays. So if you want to catch the whole group, you want to go in early Monday morning. So after their meeting, we went in, we had prepared our PowerPoints, and you know, we gave them, we disseminated, we presented our findings, and they were so excited. So for all the work that we've been doing, they've been on board. You know, they find you in Kampala, in the city, and they're like, Janet, what is happening? We want to see you progress. We want to own this program. So you want to be able to you want to be able to network with the people who are going to be consuming this, whatever research you're coming up with. It doesn't help for you to have your research, do it so well, but then it stops at the university level and you're not able to disseminate effectively. So you want to work with other people. You want, you know, we are working with the tutors, we are working with the teachers, we are working with the PTA members. There's a study that Yen talked about that we previously worked on, and we just ended it this year, and we're working in faith-based organizations. But I'll tell you that, you know, we've been to these faith-based organizations, we've attended prayers with them, even when we are not into it. You know, that's how you catch them. So you want to really be, you want to be approachable, you want to have very good communicative skills, but you want to be able to, most importantly, relate with the people who are going to consume your, you know, who are going to be the users of your research. Otherwise, it doesn't help for you to just, you know, keep it to yourself, because then you're not communicating anything.
I will add to that. I think for earlier researchers, one way that Dr. Jenny just mentioned is like in engaging community, finding out what community needs. It's a good way. And also, like, if you are interested in school health, always reach out to the researchers that you're interested, because I think for us, we're always looking for opportunity to disseminate, to share the approach. And so maybe there are ways that we can help, like guiding young investigators to see how you can set it up in your country, in your location. Even like it could be also like part of the work in the US, because I do think some of the approach that we're testing also relevant to community organization. And so we're always thinking about those opportunities.
So that's what I promised you. I promised you an exciting presentation, and people don't want even to go. We are past time, but the discussion continues. So I want to thank you so much. I want to pass this back to Janet and Laura, but I want to thank you so much for that excellent presentation. Two great presenters. We appreciate you a lot, and we love the work that you do. Thank you so much. Janet, back to you. Thank you.
Oh. Absolutely, Dr. Yen and Dr. Janet, thank you so much. We've learned with you today, greatly appreciate it. Laura and Dr. Fred, thank you for making us welcome in your network of colleagues. And as we have these lectures together, I want to note for the group that the next iChat Open Classroom program will be on February 9th. So many things coming up before then, but we would love to see you back then. And with that, we are at time. Wish everybody a very happy, healthy rest of your day. Please stay healthy and safe, and hope to see you again very soon. Bye, everyone.